protecting our mouth will cause to us is after eating and after feeding on the food in the mouth, and then excrete or release urine and its poo-poo. Now, that is what is dangerous to our teeth.
Okay.
It will now create holes in the teeth. It's acid. The tooth is a mineral. It's like a rock. Then whatever the bacteria releases is acid. Now, the acid breaks down, reacts with the mineral, and then when you remove mineral from the tooth, whatever that remains is like a cake.
Okay.
And that's how really decay comes about.
Wow. So,
Similar to that process of chemical weathering we studied about.
which course unit was that?
Not a course unit,
weathering.
primary school,
Eh.
SST.
Chemical
That's,
weathering.
there is how soil forms. There is a rock, which in this instance is like our tooth.
It was geography.
For me, I studied it in primary.
Oh my goodness.
Yes.
You're a planned kid.
No,
Let's
not really. So, there is a rock, and then there is rain coming. Now, as rain is coming from the clouds, it mixes up with carbon dioxide in the atmosphere. Now, the mixing of carbon dioxide and rain in the atmosphere will create carbonic acid. Now, that carbonic acid will fall on the rock. Now, the rock has magnesium, phosphate, carbonates. Now, the acid will react with the minerals in the rock, and then the rock breaks down, and eventually you have soil. So that's the same thing that happens in our mouth on a daily, because of the acid, either acid direct from the things we take, or acid as a result of bacteria metabolizing the food we leave in the mouth.
Okay.
Yeah.
Wow. So we're still talking about a happy mouth, right?
Yes.
Basically, and we've reread mouth brushing, which I think every person can do at the household level, at individual ground,
Exactly.
to ensure that they're brushing healthy. What other messages do you have under a happy mouth?
Under a happy mouth, I'd like us now to dive a little closer to the theme, because this is going to be a full year of us meditating on that same theme. So, a happy mouth is a happy mind. Now, we should explore a bit deeper on how our health in the mouth really affects our general health, and then eventually, in particular, affect our brain. Affects how we relate with people, how we express ourselves, and all that. You realize when you have pain, for example, there's a tooth decay, and there is pain. One, you will not be able to eat.
Yeah, maybe.
You got on a function, they are serving your best dish, and you're like, I won't eat that one. It's your best dish. For heavenly sake, you're supposed to have it. But because you know your problem, that once I put it there, it's going to be trouble. So it has affected how you're going to socialize with people. They are eating, you're not eating. And then pain also, pain on our bodies makes us sad.
It is true.
And so, once we are sad because of pain, we go into depression. It's a whole cascade. Sadness, the magnitude might increase, and then you end up into depression. Now, I would like to give you one of my experiences. You realize, okay, before that, the health of your mouth really affects each and every part of your body. Even if it means bones, it affects them. It affects the kidneys, it affects the heart, it affects the lungs, it affects everything.
Okay.
I would like people to know that even brushing alone helps you against respiratory infections. Just brushing
Like
your
which
teeth.
one is that?
Eh?
Like which respiratory tract infections?
Like toothpaste that we use, it has a bacteriostatic effect. Now, the mouth communicates with the nose.
We have different toothpastes that are on the
Yes.
brand market
Yes.
and that's ever.
But generally, most of the common ingredients in the toothpaste have a bacteriostatic effect. So your nostrils are communicating with your mouth through the oropharynx. And then from there, they separate, food goes to the stomach, and then air goes the other side. And that's why you cannot swallow when you're talking,
Yes.
because the passage of air and food is the same. Now, how you're going to get respiratory infections, they are passing from here off from the mouth and then go to the lungs. If you've brushed and you've cleared it from the mouth, then you've reduced what is going to the lungs, and you've reduced what they call the infective dose. The amount of bacteria that is supposed to be there, or microorganism to give you disease. Not every, if maybe I throw in your body one virus of maybe
Maybe flu.
maybe influenza, yes. It might not cause you any problem.
Okay.
Maybe they have to be like 15,000 to cause you problems. But now if you've cleared like 10,000 and you've remained with 5,000, it's not enough to cause you problems in your breathing system.
Okay.
So it helps a lot. It's not only about the mouth. It now goes, now that's one dimension of showing you how really taking care of your mouth can save you from respiratory infections.
Wow, I think now we've moved away from the usual saying of the mouth, of brushing only, but also into learning the real physiology and how the mouth is connected to different parts of the body. Which other relationship do you want us to talk about?
That is one in particular. But we should put it in mind that whatever that's happening in our mouth can really affect our general health. Many studies show that a poor oral health will lead to cardiovascular diseases, where we even have heart attack. Now, heart attack is the leading cause of disease, even in the United States. That can lead also to stroke. Stroke is one of the leading causes of
Morbidity
morbidity.
in Uganda.
So, but the problem can start all the way from the mouth. So if we are to think again, we should think oral health, because it doesn't end there. Now, at this moment, I would like to share my experience. I have one of my patients. He was diagnosed with migraines when she was in senior 3. She's now done with senior 6. And she has been having migraines.
The results have just come.
Yeah, the results have just come, yes. She was diagnosed with migraines. Now, in a term, she could be taken out of school to go see doctors in different hospitals because of the migraines. She has done CT scans, brain CT scans. She has done brain MRI. And brain is normal, no pathology, nothing. Surprisingly, when the dad brought her for a dental checkup, we noticed there were 2 premolars in the upper jaw on the left, and they were having cavities and they were having pus. And when we treated the infection, the migraines stopped. And that's when she was in senior 5. It's now a year since the migraines went, and they just went because of dental treatment.
When they're thinking about witchcraft?
They were thinking about lots of things, because they had seen doctors, every doctor they could recommend. Neurosurgeons, neurophysicians, what. Done all the tests.
And now the mental health part that is also upcoming in Uganda.
You see? So, this is a kid who is suffering, is a child, is suffering because of dental problem. And another thing I would like to stretch out a little bit. 90% of the dental problems do not hurt. 90% of the dental disease does not hurt. It's silent. By the time it hurts, then it has gone
beyond,
literally out of control. So the hurting at the start is around for like 10%. 90% don't of the cases. You won't have pain.
So that means that most of the persons who report, they report late.
They report late, yes. And to us as dentists, when you come and you have your pain, we clap our hands. We'll be happy.
Why?
Because that pain is a motivational factor for you to come and seek attention, our attention. That means you've been with problems because they don't hurt. You think what doesn't hurt is healthy. In dentistry, in our mouth, that doesn't apply. And for that reason, they recommend you to see your dentist twice a year. Because in 6 months, you might have developed something and it doesn't hurt. And it only needs an eye of a good dentist to spot it out for you and to be okay.
Wow.
So that girl had no pain from the teeth. She could chew well because this was a chronic infection. It happened over a long period of time, and then bacteria from the mouth now seeps into the blood and all that. Now, it's affecting the brain. And we're having migraines. And the time she came also, she was holding the head like this and the eye because of the migraine. Always on medication. Senior 3, senior 4, senior 5. 3 years.
Wow. Let's go for a short, quick break, doctor. When you come back, we should talk about a happy mind now.
Okay.
Good Day TV, transforming your life.
There is a mindset challenge that is faced by Africans all over the continent that needs to be distorted. With Dr. Bolingo's Unlock the Mind book series, this is finally sorted. Designed alongside mindset change trainings for learning institutes, churches, teenagers, and leaders, here are mind-provoking practical guidelines that put to task every African to have their own share of bread. For orders and more information, please call +256 752 831 236 or +256 755 137 187 or visit Amazon and all book centers in the city near you. Brought to you by Citizen for God's Kingdom.
God's Way High School Maganjo. With immense gratitude to God, we celebrate the outstanding achievements of our O and A-level students. At O level, we are blessed to have 2 students scoring straight 8s, 2 scoring 9 in 8 subjects, and that impressive 103 first grades. At L level, 3 students achieved an outstanding 20 points, 2 scored 19 points, and a remarkable 8 scored 18 points. We are incredibly proud that all 100 students met the university admission requirements. These results are a testament to the hard work of our students, teachers, and the unwavering grace of God. Here's to continued success.
Good Day TV, transforming your life.
Once again, I want to welcome you to our Health and Beauty program. I'm Kamara Daniel. Remember, we are talking about the World Oral Health Week, and of course, this has been an amazing time with the Uganda Dental Association of Uganda. They have done a lot of good work in Masaka City. They have treated schools, they have gone to almost every health facility in Masaka, and we know that people's mouth and their minds have been changed, just like the thing says. So, of course, I have Dr. Bruno Chagawa Serunkuma. He's an amazing young person. And of course, he's still telling us about how to take care of the mouth. And especially, he's talking about very important, sensible information. When it comes to the physiology, he's relating the things I've never heard about, actually. How the oral health affects the brain, how it brings migraine headache, how it stops the development of the respiratory tract infections. I'm yet to hear if the a happy mouth prevents the sexually transmitted diseases. Dr. Bruno.
That's interesting.
Yes.
But it will not.
Okay.
The bacteria are totally different.
It is okay.
Yeah, very, very different.
Eh.
Another experience I would like to share with you
Please do.
is with some doctor colleague who is in the United States. They got a patient with the patient developed a pimple on the left leg. And then the pimple, over a period of 2 weeks, it became an abscess. There was pus in there. And then he went to see a physician. They looked at the thing. They were like, this is like a pus. Maybe something scratched you.
They did maybe I and D.
At the start, it was a bit small, so they didn't do even I&D. So the physician gave her medication, antibiotics. She took the antibiotics. The swelling went away, the pus dried, and 3 weeks after, the pimple comes back again. It becomes an abscess again. She goes back to the physician. It's like, your pimple is back, and then there's pus. It's red, it's all that painful and all that. So they gave the lady antibiotics again. The thing went.
And it came back.
Now the third time, she's like, doctor, I'm tired. Now, when you hear that statement, I'm tired, now that means something is already puzzling your mind.
Yes.
It's affecting your well-being so much.
Yeah, generally, if something is recurrent, many questions in your mind. Is this cancerous? Is this... Now cancer is the new word on board.
Exactly.
Every person is worried about cancer. When you see something strange in your body, you start thinking about strange words like cancer.
Exactly, exactly. So, at that instance, the doctor, it's this same doctor who is treating. Good enough, this patient was seeing that same physician. So, if he was changing physicians, then maybe everyone could keep doing the same thing. Then this physician was like, no. I'm so disturbed with this thing. Let's do culture and sensitivity. Let's take off a sample and do culture and sensitivity. Get to identify which organisms are really responsible for this.
Yes, please.
When they did culture and sensitivity, they were just amused by the fact that all the organisms they identified from an abscess on the leg, they can only, on your body, they only live in your mouth.
Okay.
Only in your mouth.
So that means the microorganisms had already shifted from the mouth
Yes.
to the...
Exactly. Move through the body. Now,
in the bloodstream.
in the bloodstream.
So they're
And then-
manifesting from down.
Exactly. They got somewhere there and they're able to cocoon, form a biofilm, and then thrive there.
Oh my goodness, this is strange.
And that physician's recommendation when he was making his presentation is like, no, you guys, we should find a way of consulting.
Multidisciplinary approach.
Multidisciplinary approach.
That's what we've been talking about.
Because,
Integration.
yes, because you can't think, there is no way he would have thought about it that this infection could, an infection down here on the leg could have
Represent
its
a
source from the
problem.
mouth. And it's representing. Now, when he sent the patient to the physician, to the dentist, because of the organisms identified there, the dentist identified one tooth up here and one tooth down that have pus and no pain. And once they were treated, when they got treated, the abscess dried.
And has never come back.
And it has never come back.
Wow.
And that's happening in the United States, not here.
That's a high level consultation.
It's a high level.
Consultation.
Exactly. So,
It's very expensive. Culture and sensitivity here is very expensive. It takes a lot of time. It's, and all that. But of course, if you are to get treatment, you have to pay attention. And of course, I want to allude you for that. But now, how possible is it for me to have pus in my mouth, yet there is no pain?
because most of the dental problems, they start small and build up on that. It's called chronic infection. You get the infection, your body tries to beat it up, to localize it, and then there is a lot of desensitization of the tissues. And then once there is desensitization of the tissues, there is no pain. The way those pain mediators are literally taken out of the pathway, the infection, the disease pathway.
Okay.
So there is no pain. Most of them. Like you have gum disease, you know very well. Each time I brush and I spit, I see blood in in whatever I've spat out. That's already a chronic infection. You have no pain, it's there. Now, bacteria has bleached the barriers we have in the mouth, the gum, and it's now seeping into the bloodstream.
Okay.
But that means pus or bacteria in that pus is seeping into your bloodstream 24/7. As if that's not enough. Then for a week, for a month, for a year, it's running throughout your body. Now, it is sucked, it's taken up by blood. Now we have to remember, once blood comes from wherever it comes, it goes to the lungs. Remember, this blood now has pus. By the time your gums are bleeding, and you've seen blood, each time you brush, you see blood. Then just know you're not far away from pus. There is pus, and it's being taken throughout your entire body system. Now, from the gums, from the teeth, it's taken to the heart, to the lungs, to pick oxygen.
Okay.
Once it picks oxygen, taken to the heart, it has pus. There's bacteria. From the heart pumps it out to the entire body. And that's what's happening day in, day out. A year is done when that is happening, and you expect the brain will not be affected, your lungs will not be affected, your bloodstream will not be affected, your heart will not be affected. There are many people who actually, there are people who die from dental infection. And some of their diagnoses, because dental infection, 90% of the dental infection does not hurt. The diagnosis is made in the mortuary. You passed away, and then they do post-mortem to find out, why did this person die? Yesterday they were okay.
I'm sorry for laughing.
Only to find out that you died because of bacterial endocarditis. Bacterial endocarditis, it's bacteria coming from the teeth, now affecting your heart. And then you pack. 90% no pain. And people saw you yesterday carrying things here and there, doing your work normally. And all of a sudden you've packed. And people think you are given poison, you are bewitched, and lots of things go on. Only to get the post-mortem report, infective endocarditis, cause of death.
Wow.
Yeah.
Thank you so much, Dr. Bruno. Now, as we intend to create more awareness about the World Oral Health Week 2025, the viewers of Google Data Vision would like to learn more about you. What are some of the myths and misconceptions that surround the teeth practitioners, or maybe the patients that often present with, that's not true about the oral hygiene or the mouth in general?
One, we have many patients, okay, they are not the majority, but they still matter, who say toothpastes don't work. That's a myth.
What do they use?
They opt for other things.
The herbal medicines?
Yesterday, but when I was surprised, I had a patient who brought to me her toothpaste and is like, Musau, I was given this toothpaste, they told me it will help me, but it's not helping. I got it when the tooth has been paining me, but it has not helped. Only to look at the toothpaste, it has ginseng. You know ginseng?
Yes.
Yes, omulondo. So
Which toothpaste that ever?
it's there. I will show you the picture. They are brushing with mulondo. Now, there is no research that shows us that ginseng is really helpful to our teeth.
And I think these are the shrewd marketeers and that we have here in Uganda.
Exactly.
The shrewd marketing that you have here in Uganda. If you do not pay attention, you may...
And I would like to urge people to really listen to their doctors than listening to people who really never studied.
And these people also who move around with these with
Exactly.
herbal drugs.
Yes.
Kano kawonya amanyo, akakola bwe kati.
Ojja kulaba akawuka nga kaguddeawo after using this. That is not there. There is nothing like you can't see bacteria with your naked eyes.
Can you speak that in Uganda? That our viewers can have points of emphasis.
Bino bye mulaba olina gamba tutunda wana akalagala osimanga okateeka mu kamwana onyumunguza okumala eddakiika 2 oba n'osenyesa n'owanda n'olaba obuwuka nga butambula bwonna buba buvuddemu. There is nothing like that. Obuwuka bwe tulina mu kamwa Katonda yabututegekera buwuka bukuumi. Obuwuka obusinga obutuleetera obuzibu mu kamwa buwuka bukuumi naye obuzibu bujja lwakubanga akamwa tukalagajjalidde. The mouth can really, anything can grow there. Even if you get maybe whatever, even if you get a seed, a pumpkin seed, and you put it in your mouth and you close, give it 2 weeks, 1 week, it will have germinated, can pass through the nose.
Why did you choose a pumpkin?
I like pumpkins.
Now, just like another myth, what I've seen maybe person is that people do not know the quality of the medicines. Maybe you can give specific medicine ingredients that people should look out for before they buy this.
Okay, the very most important ingredient that almost every toothpaste should have is fluoride. Now, especially us who are really in the third world country, toothpaste should be our best thing as far as taking care of our teeth is concerned. In Europe, water is fluoridated to make sure even if you're just rinsing your teeth they get some fluoride and they get stronger.
Can we have that fluoride water sold in the markets here?
No. Tap water. I'm talking about tap water.
Yes, but I'm also asking, do we have some companies that make fluoride water here?
Maybe it's one advance that they could incorporate in.
Okay.
That might be a good recommendation. Yeah. So for them, they have fluoridated water. Their national water and sewage, their national water is fluoridated, and it's a very resource-consuming venture. But for the health of their people, they put their fluoride in the water. Fluoride is a very expensive ingredient. Some of their vegetables that are sold packed, after cleaning them and all that, they soak them in fluoridated water, so that even if you just take the vegetables, your teeth can benefit. Because the cost of looking after your teeth, like in terms of seeing a dentist and the procedures, is really high. So the best way to go is preventive. They have fluoride in some of their yogurts, some of their drinks, food products fortified with fluoride. The same way we can have our posho, maganjo, and other things fortified with vitamin
For
A.
us here, we are still fortifying for the undernutrition, my friend.
You see?
We are still fighting the undernutrition.
Exactly.
Now you want to fortify for the teeth.
No. I'm trying to compare and see
okay.
and show you how much those other countries have really
and
done.
I'm also trying to show you how fortification Uganda has
Exactly.
gone.
I appreciate that. So the only thing we have really that could give us the fluoride is literally from toothpaste.
Wow.
Now you should take a toothpaste that has fluoride. Now with fluoride, I will talk about another myth that's where people say, hey, research shows that fluoride can make your brain dense, can make your brain to become like bone, calcify. That is not true. That's not true. The fluoride you have in the toothpaste is literally the bare minimum. It cannot cause problems. Yes, fluoride, when fluoride is too much, it can cause problems. There's what we call fluorosis, whereby it damages the tooth structure, making it like as if have very many pits. Yeah. People who live like in the Rift Valley area, there is too much fluoride. So their teeth end up getting spoiled because of too much fluoride. But this fluoride we are talking about in the toothpaste, it's regulated.
It's very small.
Very healthy. And very protective. And this is how actually it works. When you take fluoride, fluoride is highly electronegative. It has a negative charge, a powerful negative charge. And it diffuses through the tooth. A tooth is it's not like a rock. It has pores. And that's why some things you can sense that each time I take this, I feel my teeth are hurting. Or they are super sensitive. It's from the other property of the tooth having pores, not a solid thing. It has pores.
Yeah, actually, I also have some toothpaste that I use. That when I use it, but when I use this one, it detects some sensitivity and it clears it. I don't know.
Exactly. So some of the toothpastes aim at sealing those pores once they get extremely open. Yeah, and that's how they prevent sensitivity. But
Wow.
now, once back to the fluoride toothpaste. Fluoride, once it's used in the mouth, it diffuses into your teeth. Once it diffuses, you have minerals in the saliva. Saliva is always bathing your teeth. And it's full of minerals. Magnesium, phosphate, calcium and all that. Now, when fluoride has entered inside the tooth, it acts as a magnet to pull these other minerals that are in saliva and lock them up inside your tooth
Okay.
to make it as strong as a rock.
Okay.
And that's how actually it helps. And it's important for people to know this kind of science, such that next time when someone is giving you false information, you're like, I have some good information from an informed person.
Okay.
Yeah.
Wow. Thank you so much. We intend to wind up this very important program. Now we want to look at what are some of the bad habits that destroy teeth, that are especially common in Ugandan setting. We had earlier talked about smoking.
Yes.
What are some other habits that we've observed from especially the young people and also the old persons in the wrong process maybe?
So, better to look at it in this way. Anything that really take you away from your normal understanding will really affect your oral health and it will affect your mouth. Take an example. If I spend a whole night in the bar drinking and I'm drunk,
You reach home and you brush.
they even take me home. I don't take myself home. They take me home.
They drop you.
They drop me in my bed. I've been drinking the whole night. Now, the whole day I'm going to sleep in bed with hangover and all that. It's possible that I can miss brushing for a full week. Because the moment the hangover gets out of me, I want to know where is the next plot. I add. It's that much of the times in the drunkards really find their oral health is really bad.
Okay.
Because it makes you to neglect. It makes you neglect you can't brush because you're not there.
You're not aware.
You're not aware. So, alcohol. Alcohol in the other dimension of too much. That's being
Is
a
there alcohol
drunkard.
that protects the teeth? Is
No.
there alcohol that can
No,
preserve
no,
the
no.
teeth?
There isn't.
Okay.
There isn't. Yeah. So the problem really comes from the fact that it has made you neglect taking care of your teeth.
Okay.
Yeah. Then smoking definitely kills the blood supply of the gums and then also the teeth as well.
Okay.
So those the nicotine and tar in the smoke makes the blood vessels really to die away. And any structure you have that cannot get blood definitely rots.
Dies away.
Yes, that's why we have too much gum disease going on in smokers. Because the smoke has really killed the blood supply, and gum is literally dying.
Okay.
Yeah, so we end up with gum disease, and gum disease is very terrible. You rather have cavities than having actually gum disease.
Okay.
Because gum disease, you can lose all your 32 teeth in 1 year.
Let's not scare the viewers. Let's talk about another bad habit that can.
Okay. Another bad habit, it could be nail biting. Have you ever thought about it?
That
Yes.
Ah, okay.
Nail biting.
You have
nail
a
biting
you have a culprit.
Nail biting is a bad habit.
Okay.
Because you see how your teeth are relating. The lower teeth go a little under the upper teeth. But when you're going to bite, you don't bite like this. You bite like this. And you grind your teeth. It's a habit that makes you grind your front teeth. And we've seen some patients where the front teeth are extremely short because of nail biting. And when you look at their mouth and you try to you try to ask them a few questions to discover what exactly is causing the problem, you find them hiding their nails like this. Because you're getting there. They don't want you to really get to have the evidence.
So Dr. Bruno emphasizes that if you have to think again, even as you wake up, you think about your oral or your mouth. I want to thank you for being a good viewer of the Health and Beauty program. Do you have any regards to your family?
Oh,
to your wife?
Yes.
You greet a few and then we leave.
I'd like to send greetings to one, my dear mother, Namgaba Rosemary. I think, you're seeing me. You might be there seeing me. If you're not, yes, I'll send you a clip. But I'm sending a very, very, very
wow, I am so
good
happy.
message to my mom. Then my dear patients, I think before I even leave this place, they will be already sending message. Oh, doctor, we saw you.
Wow.
That's good. So,
That's
to all my dear patients, to all Ugandans, to all people watching Good Day TV, please tune in.
Thank you so much. Thank you so much, Dr. Bruno. And for this very important health and beauty program, I'm Kamara Daniel. Hope to see everyone Wednesday at 9 p.m. Take care.
Good Day TV, transforming your life.
Programu eno You Can Be Delivered osobola okusumululwa YCD ekutuusibwako obuweereza bwa Raising David's Tabernacle Ministries RDTM. Tugenderera okuyimusa eggye erisinza Katonda mu mwoyo ne mu mazima, okutwala Kristo eri emitima gy'abantu n'okukuteekateeka ku lw'okudda kwa Mukama waffe Yesu Kristo. Twegatteko leero era gw'ayagala okwogerako n'omusumba kusabirwa, kuwabulwa, bibuuzo oba ensonga endala yonna, yita ku 0776829263 oba 0702829263 eri ne ku WhatsApp. Tugoberere ku mikutu gyaffe ejja social media: WhatsApp, YouTube, Telegram, Facebook, TikTok, X. Mulinnya You Can Be Delivered.
Tosubwa ku Good Day TV.
Abaagalwa abalungi, erinnya lya Mukama waffe Yesu Kristo lyebazibwe nnyo. Mbalamusizzaako. Amannya gange nze Kasozi Robert Cephas. Mbanjulira nungi mwogenda okuyita okusisinkana Kristo okwate ku bisuubizo omululwe owangule eyitibwa You Can Be Delivered ngekutusibwako obuweereza obwa Raising David's Tabernacle Ministries wano ku Google TV buli lwa Sunday okutandika essaawa 5 ez'ekiro n'okusatu okutandika essaawa 3 ez'akawungeezi tugendanga kubeera wamu oludde mu bulwadde olinayo ebintu byonna ebikutawaanya wadde nga walokoka olinayo ebintu ebyo nga obisabidde naye nga bigaanyi oba nsonga ya birooto ng'ebirooto bikufuukidde ebirooto tobitegeera ogezezzaako eno n'eno puroguramu eno egenda kubeeramu essuubi ekyokuddamu okuwangula okubotola